Trauma is an emotional response to a deeply distressing or disturbing event. It can result from a wide range of experiences, including accidents, physical assault, natural disasters, or witnessing violence. When a person experiences trauma, the impact can disrupt their sense of safety, stability, and trust. For some individuals, the effects of trauma can be profound and long-lasting, leading to the development of post-traumatic stress disorder, or PTSD. PTSD is a psychological condition that arises after someone has been exposed to a traumatic event, significantly affecting their thoughts, emotions, and behaviors. The experience of trauma can affect people in various ways, with some individuals experiencing immediate distress that fades over time, while others may develop more severe symptoms that persist for months or even years. These symptoms are often grouped into 4 categories: intrusive memories, avoidance, negative changes in mood and cognition, and heightened arousal. Intrusive memories include flashbacks, nightmares, and persistent unwanted memories of the traumatic event. Individuals with PTSD may feel as though they are reliving the trauma, making it difficult to differentiate between past and present experiences. This re-experiencing of the event can lead to significant emotional distress and physical reactions, such as an increased heart rate, sweating, or a sense of fear. Avoidance is another common symptom of PTSD. Individuals with PTSD often attempt to avoid reminders of the traumatic event. This can include avoiding places, people, or situations that are associated with the trauma, as well as avoiding thoughts or feelings related to the event. While avoidance can provide short-term relief, it often leads to greater isolation and emotional numbness in the long run. For example, a person who has experienced a car accident may avoid driving or riding in cars even if they need to travel for work or other important reasons. This avoidance can have a negative impact on the individual's ability to engage in daily activities and maintain relationships. The third category of symptoms involves negative changes in mood and cognition. Individuals with PTSD may experience feelings of hopelessness, guilt, or shame. They may have difficulty trusting others, and they may feel emotionally detached or disconnected from loved ones. This detachment can lead to a lack of interest in activities they once enjoyed and difficulty forming or maintaining relationships. Cognitive distortions, such as a persistent sense of threat, may also be prevalent, where the individual constantly expects danger or harm. For instance, they may assume that the traumatic event will happen again, which can lead to heightened anxiety and a sense of being on constant alert. The fourth category of symptoms is heightened arousal, which refers to an increased state of physical and emotional tension. Individuals with PTSD may experience irritability, difficulty sleeping, hypervigilance, or an exaggerated startle response. These symptoms can make it difficult for individuals to relax or focus, as their bodies remain in a constant state of fight or flight response. Hypervigilance can also lead to a heightened sense of danger, causing individuals to constantly scan their environment for potential threats, even in situations where there is no immediate risk. PTSD is not limited to any specific demographic and can affect individuals of all ages and backgrounds. However, certain factors may increase the risk of developing PTSD. A history of previous trauma, a lack of social support, and a tendency toward mental health issues such as anxiety or depression can all contribute to the development of PTSD. Additionally, the severity and type of trauma experienced can impact the likelihood of developing this condition. For instance, individuals who have experienced chronic trauma, such as ongoing abuse or living in a war zone, may be more likely to develop PTSD than those who have experienced a one-time traumatic event. The effects of PTSD can be far-reaching, impacting many aspects of a person's life. Employment and academic performance may suffer as individuals struggle to manage their symptoms. Relationships with family members, friends, and colleagues may also be strained due to the emotional and behavioral challenges of living with PTSD. The condition can also lead to other mental health disorders, such as depression, anxiety disorders, and substance use disorders, as individuals may attempt to cope with the emotional pain through unhealthy means. Treatment for PTSD typically involves a combination of therapy and, in some cases, medication. One of the most common and evidence-based therapeutic approaches is cognitive behavioral therapy, which helps individuals identify and challenge the negative thought patterns that contribute to their symptoms. Exposure therapy is another effective treatment where individuals gradually confront and process traumatic memories in a safe and controlled environment. This can help reduce the emotional charge associated with the memories, allowing individuals to process the trauma and gain a sense of mastery over their reactions. In addition to traditional therapies, other therapeutic modalities such as eye movement, desensitization and reprocessing, and trauma-specific mindfulness practices have shown effectiveness in treating PTSD. These approaches work by helping individuals reprocess traumatic memories and integrate them into their current sense of self in a way that reduces their emotional impact. Social support, including family therapy and group therapy, can also play a crucial role in the healing process. Support groups allow individuals to connect with others who have had similar experiences, reducing feelings of isolation and providing validation and empathy. Lastly, it is important to recognize that recovery from PTSD is not a linear process. Individuals may experience periods of improvement followed by setbacks, and the journey to healing may take time. Mental health professionals must be patient and compassionate, providing consistent support while also empowering clients to develop their own coping strategies and build resilience. With the right treatment and support, individuals with PTSD can lead fulfilling lives and regain a sense of control over their emotions and experiences. Through comprehensive care, it is possible to help those affected by trauma heal and thrive once again.